On this edition of the Best Docs Network featuring Forest Park Medical Center, plastic surgeon Dr. Richard Ha. Craniofacial surgeon Dr. David Jennikov. Bariatric and cosmetic surgeon Dr. Clayton Frenzel. ENT Dr. Andy Chung. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, Forest Park Medical Center is one of the premier medical centers in all of Dallas-Fort Worth.
Yes, indeed, Candace. We're going to start the program with, a lot of great physicians operate here out of beautiful Forest Park Medical Center. And the first one we'd like to introduce you to is plastic surgeon Dr. Richard Ha.
Babies with cleft lip and palate are born every year. The incidence is about 1 in 700. So while it's not very common, most people probably know somebody who may know somebody who had a cleft.
When we got our referral approved from the Chinese government, it said that we were going to get a child with bilateral cleft lip and palate. We took our referral picture to Dr. Hall and asked him if he could fix her. And he said, I'd be happy to. And I was thrilled. It was a huge sign of relief that he was going to be there for us.
Andrea is a delightful child. She came to me after being adopted from China. She had a bilateral cleft lip and palate, so that was a little bit more severe deformity than you might find with a one-sided lip or just an isolated cleft palate. But she had some work done in an initial repair in China. Clearly, a very rudimentary repair had been done, and she didn't have the full treatment plan completed.
I've heard that the average cleft child has 8 surgeries, and she will be average. She's had 7 so far.
The treatment plan for these patients starts at very early age. A lot of specialists are required to help take care of these babies in the proper way. It's not just the plastic surgeon who's going to be doing the repair, but you need speech pathologists, orthodontists, dentists, as well as ENT surgeons. And together, you come up with a comprehensive approach and a treatment plan. So I performed a lip and nasal revision, as well as fixed the remaining hole in her palate, as well as did a procedure for her to improve her speech.
Her next procedure will be when she's around 16, where they'll move the upper jaw forward and do maybe a rhinoplasty as well.
She had initially had some language transitional issues, but quickly learned English, and she is very well integrated and just a happy child at school.
She looks fabulous, and she's a resilient child. She's always happy, and she loves the way she looks. And Dr. Hall has really changed her life.
I love Dr. Hall.
We are proud to be a part of the Marine Corps Reserves program for Toys for Tots. This is the 4th year that Forest Park has been a part of that, collected toys, collected money, and this year is bigger and better than the year before.
What Toys for Tots does is your kids that don't have the money, their parents do not have the income to provide toys, it's for the kids, strictly for the kids. And we have Forest Park Medical Center that's donating toys and some remote control cars for us, and donated some money as well, and in support of the campaign this year.
We put out a message to all of our employees that we would be participating in the Toys for Tots again this year, and put up collection boxes throughout the hospital and encouraged employees to participate. We also had a jewelry sale where a portion of those proceeds went to donated just cash to the Toys for Tots program.
I'm with the business office here in Forest Park Medical Center, and we had a contest for a Christmas tree decoration. We had to come up with a theme, and our theme was to collect. So the name of our team was Collection Express. What we did is gathered up money to donate to Toys for Tots, and we came up with the idea of making ornaments of money, and we won the contest first place. All the money that we used to make the ornaments out of, we are actually donating to Toys for Tots.
This year our collection was large enough that we were unable to just physically take the gifts in a car, which is what we've done in the years past. And so the Marines were willing to come out and collect them for us. And so we're going to present them with our donation and also the cash donations that we've collected.
We're extremely grateful that Forest Park, any contribution, no matter how big or how small it is something that's going to help an individual kid at this point. Their contribution is substantial. It's a nice group of toys.
One of the things that's important to us at Forest Park is to give back. To the community. And one of the ways that we can do that is through this Toys for Tots program. It's a lot of fun, and I feel like the employees are excited about having the opportunity to think about a child that opens a gift on Christmas morning and has that, excitement of this is something really special.
When cochlear implants were first developed, we only placed them in adults who had acquired their hearing loss later in life.
I had normal hearing as a child, and I didn't really notice a hearing loss until I was in my late 20s. Finally, the hearing aids no longer helped me, and the audiologist that I had been with for years told me, you might consider a cochlear implant.
It is because those adults already have in their brain the language abilities and the hearing abilities that they've acquired over their lifetime that we can truly determine what it is a cochlear implant is able to accomplish. And even to this day, the most ideal and most simplest to acquire good hearing with a cochlear implant are our adults.
Every time I would get a new hearing aid, I would get so hopeful that the new technology would give me some clarity, because I could hear the sounds. The hearing aids amplify everything, but I couldn't understand. Until after I had the surgery, I didn't realize really how depressing it had become. It has just been amazing. Everything Dr. Peters predicted definitely came true, and my expectations have been so far exceeded.
Many of those patients, we can turn on and activate their implant on a day, and already immediately they understand speech. It is a often tearful process because many of those patients are now hearing things they remembered hearing many years ago and hadn't heard them for a long time. Their wife's voice, their children's voices. So those adults like Lynn have great stories to tell, and many of them would say it's given them their life back again.
I would feel so comfortable to send anyone that was considering it at all to Dr. Peters. It was just incredible. This has been a total miracle in my life.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
The Best Docs Network, featuring Forest Park Medical Centers, is all about their amazing facilities and their amazing doctors, like Dr. Clayton Frenzel, who we're going to meet next.
After 5 years of general surgery, I did a fellowship to learn how to do bariatric surgery for 1 year. And then I did a second fellowship in cosmetic plastic surgery. And that allows me not only to take my patients through the weight loss surgery, help them lose the excess weight, but in addition to that, after they lose the weight, I can do the reconstructive surgery that addresses the excess skin that they're going to have or that they may have after they lose the weight.
When I started seeing Dr. Frenzel for my follow-ups, I'd lost about 100 pounds, and I ended up losing about 115.
And after her gastric sleeve, she had significant excess skin in multiple areas of the body.
After 115 pounds, you have a lot of skin that is sagging, and I needed a total reconstruction.
Not every bariatric patient that is going to need this type of surgery, but
If you lose over 100 pounds, most patients will have some skin issues. The 4 areas that are the biggest concerns are the abdomen, back, the breasts, arms, and thighs.
When he saw that I was pretty much down to where I was going to be and wasn't going to lose anymore, then we started talking about the reconstruction. And I wanted it all done at once, and he says, no, it doesn't work that way. So we did it in stages.
My number one goal is to get the patient to a healthy weight, okay? This is about getting the patient healthy. However, during that time and this massive weight loss, they can form this excess skin. At that point, the skin usually needs to be addressed.
And I said, I just want to look normal. I don't want to look fake. And he said, I can do that. I said, okay, I'm trusting you then, do it. And he just did a fabulous job. I look normal again.
And it's not until they take the skin off that they say, you know what, now I feel like my transformation is complete. Now when I look in the mirror, I see the person that I know that I am. Cindy did very well, had excellent results. She recovered nicely.
He gave me back me, because I've always been a very outgoing person. I love to be around people. We have a great life, you know, and I have my life back because I get to do anything I want to do.
Did you know that Forest Park Medical Center is equipped with a high-tech tube system that sends stat lab work from any location in the hospital to the lab? This enables the lab to test samples quickly for better patient care.
I had pain in my right knee, and at that time I did what's called a procedure called microfracture surgery, which is a normal procedure where you infuse blood in there to create a cartilage-like feel in your knee, and that was in my right knee. Then in 2010, I had pain in my left knee, and at that time is when Dr. Michelson told me about the new procedure called Carticil.
ACI is basically stands for, it's an acronym for autologous, which means from the same patient, chondrocyte implantation. And it's a procedure that's done for cartilage damage in the knee. So essentially, the surgery is a 2-stage procedure. The initial surgery is where the knee is scoped and any other abnormalities within the knee are taken care of. The second surgery is a more extensive surgery involving what we call an arthrotomy, complete opening of the joint. The cells are implanted at that time, and then the patient goes through a little bit more extensive recovery. That recovery starts off slow, sometimes using crutches and braces and not bearing weight on their leg, to about 8 weeks where they're without brace, walking on it. But those cells take time to mature, and that maturation occurs over the course of about a year.
In May of 2011, we went in and took out cells so we could grow the cartilage, and then we had the full surgery in December to sew in the grown cartilage and go from there. Within 3 months, I was back at the gym on a pretty regular basis, and then within 6 months, I was doing even more strenuous exercise. And then now, 10 months later, I'm actually jogging on a treadmill.
It has been all but to hold back the reins on him. He's back up, he's running, he's jogging, saying that his knee feels better than it has in a very long time. He's had an excellent outcome.
It's funny, you know, when you first have the surgery, all you think is about that knee. You feel it in everything you do in every walk of life right after the surgery. But then, of course, today, I don't even think about the knee now. And that's probably the best endorsement of all. Dr. Michelson is a really good doctor. Thank you, Dr. Michelson, for giving me my legs back, so to speak.
We're here at Forest Park Medical Center, Dallas, where we are a bariatric center of excellence through the American Society of Metabolic and Bariatric Surgery. What a bariatric center of excellence is it's a designation that a facility has to actually apply for. It covers 10 very vigorous standards that are set forth from the American Society for Metabolic and Bariatric Surgery, and they actually come and interview, they audit charts, they look at outcomes, and they look at 10 very vigorous standards to make sure you meet those standards, from the equipment you have to care for your patients, the personnel that you have involved taking care of the patients. And it's there for patients to be able to select a facility that is above and beyond for their care of bariatric patients.
Part of being a bariatric center of excellence means that we're able to handle any complications that occur with our patients. So we have several physicians that we can consult for whatever needs we may have, whether that be pulmonology, nephrology, neurology, any of those things that we may need. We have those here at our fingertips, and we have that for the ICU and the ER as well.
I oversee all of the medical nutrition therapy both before and after surgery with the bariatric patients. So up to 6 months prior to bariatric surgery, patients can come and see us and work on lifestyle changes. And then we also visit with the patients here in the hospital immediately after surgery, and we offer post-op classes just to kind of keep everybody on track up to a year following the procedure.
I help teach the pre-op in the seminar classes for our bariatric patients or our prospective bariatric patients. We do inpatient teaching after they've had surgery, as well as do the lap band adjustments once they've had surgery. We do upper GIs. We do see them from prospective patients, and post-op wise we see them throughout the whole course of their procedure, as well as 2 years out, 3 years out, so we continue to follow up with them and see how they're doing and continue their education.
The pre-op procedures that we do in radiology are the upper GIs, and they like to do that to be able to see the intestinal tract before they have surgery, so the doctor knows what they're working with. And then post-op, we bring the patients down and we do upper GIs so that the doctor can make sure that all the suture lines look good and there's no leaks and everybody's good to go home.
We do around 3% of the cases nationally for bariatric surgeries. That means that out of all the thousands of bariatric surgeries nationwide, this specific hospital does 3% of them.
We have a great multidisciplinary team, and we do have a great team of our dietitians, our nurses, our surgical staff, our respiratory therapists, physical therapists, radiology techs, everyone. And it takes every one of those members of the team to provide great patient care. And without any one member of the team, we couldn't be as effective as we are.
As always, for more information on the amazing Forest Park Medical Center or any of the fine doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and be sure to click on the Forest Park Medical Center tab.
There you go. And right now, it is time to go to our next doctor who operates right here out of Forest Park Medical Center. It's Dr. David Jennikov.
My life started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Jennikov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on, then everybody's a winner.
Jennifer has a question for Dr. O. Her question, she's been diagnosed with HPV. What does that mean?
So I see a number of young women in my practice who come to me with an abnormal pap smear showing HPV changes, and this has these patients extremely concerned because they feel like they have been exposed to a, quote, sexually transmitted disease. Part of what I tell my patients is that the HPV virus is endemic in the population, that it's present in most people who've had sexual intercourse. For the majority of these patients, it doesn't create any issues. The body sees it and it clears it or it isolates it, and so it doesn't create a lot of problems. For a small percentage of patients, it can create abnormal pap smears, but even these abnormal pap smears can be very readily handled and treated non-invasively as long as the people keep up with their exams.
Did you know the spacious operating rooms at Southlake Forest Park Medical Center will feature the latest technology, including the ability to live stream video from surgeries to nurse stations and other Forest Park campuses. The Dallas location has an auditorium where doctors can gather to watch a surgery.
For the last about 10 years, my life had been slowly getting smaller and smaller. I was unable to walk. My weight had ballooned up during that last year that I was unable to walk, and I had been wanting to look into the weight loss surgery for several years.
Obesity has been told to cause approximately one article about 86 diseases, but it also appears to be a risk factor for at least a dozen cancers, particularly some of the female cancers. We know that some of the cancers that are particularly hormonally related, such as breast or endometrial or uterine cancer, is exacerbated because of probably some of the extra hormones that people get from the extra fat cells.
I had many health issues that were going on in my life. I had diabetes, I had high blood pressure, I had what's called metabolic syndrome. My waist was larger around than 6 feet, and I was unable to walk due to osteoarthritis. I had discussed many options for the weight loss surgery with Dr. Davidson in his office, and the gastric bypass turned out to be the best option for me.
So what I like about bariatric surgery is I love to put diseases into remission so that people their atherosclerosis or their hardening of the arteries doesn't progress because they don't have their diabetes and all the inflammatory responses of the body that you get from the metabolic syndrome with being overweight. I also like bariatric surgery because it actually decreases people from getting cancer. Well, my feeling is that weight reduction surgery should even be used as a means to both prevent and improve the prognoses of people that have cancer.
I really enjoyed my time with Dr. Davidson. He is a straight shooter. He is a very intelligent but a very kind person. He lets you know exactly what you can be expecting, and he is a perfect partner in the weight loss process with you.
Now to our next doctor who operates right here out of Forest Park Medical Center. It's one of the top ear, nose, and throat doctors. It's Dr. Andy Chung.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor, so I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
For the last 25 years, I have taken care of everybody but myself, and I have 3 children, had them very young, and I haven't really had an opportunity to take care of myself. So it came time for me to renew my lease on my vehicle, and I made a decision to get a luxury body versus a luxury vehicle.
Mommy makeover is a term that we use to describe a combination of abdominal surgery, breast surgery, and liposuction. Breast surgery entails breast augmentation, breast lifts, or breast implants with a lift. Abdominal surgery includes most commonly an abdominoplasty or a tummy tuck and liposuction.
I wanted implants, and I also wanted my stomach fixed from surgeries, from having children. Seems like no matter how much weight I lost or gained, I just couldn't get my stomach the way I wanted.
She's very active now in running and in exercise and going to the gym, and she just couldn't firm up her lower abdominal area and her breast tissue. So no matter what she did, it wasn't going to be corrected with exercise and dieting. The plan that we chose for her, which included abdominoplasty and breast lift surgery with implants, was a plan that was tailored for her to help her with the issues she's had with her breasts and her abdomen.
After my procedures, I was actually able to go home. I didn't even stay a full day. Even having all 4 procedures done at the same time, I was able to go home like 12 hours after.
It's about a 2-week recovery of no activities. All they're doing is just walking around the house, and they're bent over. They need to be bent over to decrease the tension on their closure. After 2 weeks, they increase their activity level to mild activities. After 4 weeks, it's moderate, and after 6 weeks, they can fully engage in whatever activities they were doing prior to surgery.
I'm very pleased with the outcome, and I'm very comfortable. I was looking for something a little more natural, not so it looked like I was having procedures done, and he did exactly what I asked.
All right, Candace, that will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, some of the best medical centers in the entire Dallas-Fort Worth area.
You bet it is. With unsurpassed service, exemplary care, and the highest quality medical facility, prepare to have your expectations exceeded. And of course, for more information on any of the doctors or Forest Park Medical Center, visit our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
There you go. And if you have a question or comment for us, send us an email at info@bestdocsnetwork.com. So long, everyone. We will see you next week.